Thank you and hello. My name is Peter Hanlon and I am a GP alongside doing my PhD. And a question that I'm often asked when discussing treatments or recommendations with patients is, will this treatment benefit me and what are the risks to me of taking this drug, for example? And these are really important questions, but sometimes really difficult to answer. And it's particularly difficult when people are living with frailty. So by frailty, I mean a situation where people's body systems are more vulnerable to decompensating or losing function when they're put under stress by an infection or by drug side effects, for example. And frailty is really common. So 5 to 10% of people over the age of 65 are living with frailty. And that rises to over half of those who are aged over 80. So this accounts for a massive proportion of what we see within primary care. And for people living with frailty, judging the risks and benefits of any given treatment are really challenging. So the two things that I would need to know to actually recommend a treatment to someone are, for the condition they have, for example, type 2 diabetes, what can we expect to happen to them over time? What are the main risks of their condition? And the difficulty is that most studies of individual conditions don't measure or account for frailty when they're answering these questions. And the second is, how effective is a treatment that I'm trying to recommend? So for this, I'd like to rely on evidence from randomized controlled trials, as we know that's the best type of evidence. But trials don't report or measure frailty. And also some speculate that many people with frailty are excluded from clinical trials. And so it's not clear if the conclusions from trials can be reasonably applied to the massive number of patients that I see who are living with frailty. However, I believe that it's possible to answer some of these questions using data that we already have, and that's the aim of my PhD. So my PhD aims to answer two questions. One is for a given condition, such as diabetes, how do the risks of complications differ between people with and without frailty? And second, for these conditions as well, as how common is frailty within drug trials compared to the population in general? And are there differences in the way that people with frailty respond to treatment? So to do this, I'm going to use a combination of routinely collected healthcare data, longitudinal cohort studies where people are followed up over time, and also individual patient data from industry-sponsored drug trials. And for each of these, although they don't explicitly set out to measure frailty, by pulling together data from long-term conditions, from symptoms, from functional measures like difficulty washing and dressing, we can create a quantification of someone's frailty within these data sources. And by doing this, it's possible to use existing data to answer really important questions about how clinicians might be better equipped to judge the risks and the benefits for people living with frailty. Thank you.